Good morning.
Hello again.
So we had a great episode today with Victoria Gonzalez.
Dr. Victoria Gonzalez.
Dr. Victoria Gonzalez, yes.
So I went to school in Oregon and got her bachelor's degree there. Went on to do a doctorate at UCSB and now focuses on patients in infertility, pregnancy, postpartum,
Yeah.
and just a wealth of information. And she's also works with Calm here in Santa Barbara.
I thought she was really interesting to talk to. I initially met her with Dr. Drake, and just after talking to her for a few minutes, knew that she'd be perfect for the podcast. Enjoy the episode.
Dr. Victoria Gonzalez, welcome to the Vagina Doctor podcast.
Thank you.
It's really great to have you here today.
I'm really excited to be here. Thank you.
A clinical psychologist, bachelor's degree from Oregon, and then a doctorate at UCSB.
Yes, correct.
And now you have your practice here has been a private practice, been more than that now. But tell us about how you got the private practice part of it. Oh. And then we'll talk some more about the other things that you're doing.
Great. Thank you. Yeah, so it's been a long journey. I think one of my first jobs out of undergrad was working with mothers and children, and it was mothers who were incarcerated at the time and had children. They were either pregnant at the time of incarceration or had children under 2. And they were in an inpatient program, basically serving out their sentences and able to live with their children. And I was maybe 22 at the time, and I was doing intakes with them and developmental assessments with their children. And it was through that work that I really saw mothers doing their best and wanting the best for their families. And in that moment, I felt really compelled to the work, to work with mothers and children during this sensitive time. So it snowballed from there. The next positions I had going to graduate work, always in some way in prevention and early intervention care. And during my graduate studies, I focused heavily during the 0 to 5 time. So focusing on postpartum depression as well as parenting and child development at that critical ages of 0 to 5. And I loved the work and I worked very closely with the children, but I always felt like a longing to stay with the mothers a little bit longer. I always felt, and of course there's research to support it, but I always felt like if I could just spend a little bit more time with this mother and helped this system, that the rest of the system could be much more healthy, thriving, and functioning. But it wasn't until I had my own pregnancy journey, it wasn't until I had some infertility that I was seeing a therapist regularly, but I was like, there's something she's missing here. She was a great therapist, but there were questions she wasn't asking. She wasn't guiding me in. And I felt like there was really something lacking. So with my background in PhD, I started to do research, which that's where I find comfort, right? And I said, there is research here, but there's not a ton. And there are actually people who focus on reproductive psychiatry and psychology. So there is information here, but there weren't a lot of people locally doing this work. This was maybe 10 years ago. At the time, there were 2 people locally focusing on maternal mental health. And so I figured at that moment, okay, now I know I have all this knowledge. I have the background, but I thought if not me, then who else? And that's when I started my private practice, was after I delivered my son. So in 2018 is when I started my private practice, when I felt like I got additional training in maternal mental health, more experience, and I really wanted to start offering what I needed
and
at
your
the
own
time.
Personal experience,
yeah, my own personal experience, and I'm also enwrapped in this world. My mother was a labor and delivery nurse, postpartum nurse for 30 years. She's a lactation consultant.
Wow.
My brother's a neonatologist. His wife's an OBGYN. My sister's in women's health at Planned Parenthood. So I'm just steeped in this world, and it's what I love. It's what I love to talk about. It's what I love to focus on. So when I get to sit down with my patients and support them, there's no better feeling.
So you saw a need here in the community initially and all these various stages of infertility, pregnancy, postpartum. Is it just more common now that there are these needs, or has it just been ignored before? Was it covered by a larger family and help from grandparents and sisters and brothers and so on? What's your thinking about that?
Absolutely. I think it's both. I think that the lack of the village, as they say, it takes a village to raise a baby.
Yeah.
There's a lack of that village. So that can lead to isolation and overwhelm in ways that aren't really preventable because you might not live
Right.
near people that can step in to help. I think it's more prevalent because we're starting to know more about it. Postpartum depression, I think there was more of a lens on that, let's say about 10 to 15 years ago. But the way that we understood postpartum depression was a very severe case, right? It's more what in the movies when someone's weepy all day long, they don't want to hold their baby, they're having scary thoughts. What we know now about PMADS, postpartum mood and anxiety disorder, is that there's a whole spectrum and there's all sorts of different levels of anxiety or depression or a combination of both. It can be really nuanced. For example, when I was going through my kind of some more training in maternal mental health, I learned that if you are not sleeping when your baby's sleeping, that can be a very strong indication of postpartum anxiety. I didn't know that at the time, and I was pregnant with my second child. So they're just these little questions that you could ask to be a little bit more aware of. Is postpartum anxiety or depression occurring for you? The sense of overwhelm that happens for new mothers is real because there's a big change in your life.
Yeah.
And
Yeah.
people say there are no guidebooks. Sometimes there's too many guidebooks. So knowing the right way to do things, especially if you're a competent person, and then all of a sudden not feeling competent, can lead to all sorts of feelings and thoughts. So I think we've broadened our idea of what postpartum mood and anxiety looks like. So I think people are starting to identify it in themselves and others in a way that we didn't before.
Yeah.
And I think just the lack of support, in addition to the expectations that we have in society of what mothers can accomplish or what birthing people should be able to do, I think sometimes are too high. The bar is set too high. And so sometimes people are just set up to feel like they're failing.
Yeah, especially too when you bring up like the infertility component, because if you went through infertility and I went through infertility and then you finally get your baby, right? Or for me, it was a decade. I remember my husband saying, "Why aren't you happy you have the baby?" But what I couldn't even put my finger on was what was wrong. I was feeling lonely. It's a very lonely time after you have a baby. People come and then they leave, and then you're there. And then also, I had that panic, that middle of the night panicking up, just the hormonal drop and the panic. Digging in the bed, thinking the baby was in the bed, suffocating. It was terrifying. And I had it like every single night. And the baby wasn't in the bed. The baby was in her bassinet. So there was no rhyme or reason to it. It was just something I couldn't control. And it never occurred to me that I could talk to someone about it or that this was normal, or I just kept it to myself, all of it.
Yeah, I mean, those feeling, first of all, I'm really feeling for your journey. Sorry that you had to go through all of that alone. I think that's kind of my push, is that you don't have to go through this alone. It's never your fault when you experience this. There can be so much shame around it. Most people do keep those thoughts to themselves. And if you do open up, it's the fear of the judgments that will come. Or what does it mean about me as a mother? I've wanted to be a mother for 10 years. And now I'm a mother and I can't handle this. It's making me panic. I don't know what to do. You're likely going to keep that to yourself unless your OB maybe is talking to you about what to be aware of, some signs and symptoms. And most birthing parents have scary thoughts. I just think that there's so much pressure to feel like you're a good parent. And if you're admitting any of this to yourself, sometimes it can feel like you're defeated. Okay,
Yes.
I'm not fulfilling this role that I had imagined often for many of us ever since you were little, imagining what would it be like to be pregnant? What would it be like to have a baby and bring them home? And then those expectations not meeting reality. That chasm is sometimes what really needs to be supported and just flushed out a bit.
It's such a shift because I think for most people, for me, I went from working my whole entire life to then taking care of a baby. I stopped working. So that alone was the difference of doing one thing to another thing. And then I remember feeling again like it was the happiest time of my life having a baby, no question, but the most lonely.
Yes. Yeah.
Just terribly lonely.
Yes. I think you mentioned one thing, that it's lonely, but it's also even more lonely if you're keeping some of these thoughts and experiences to yourself. then a lot of times when you feel lonely and you isolate, that just further exacerbates what you might call postpartum depression, or just that isolation, that loneliness, that overwhelm. But the identity shift that you're talking about, that's something I really, so much of my work is talking about that identity. What does it mean now that I'm not working?
Yeah.
How can I often, so most of my patients come to me and they were very successful in life, really high achievers. People type A like to cross off their to-do lists and, like I said, quite successful. And then they have a baby and there's this, it's really hard to feel successful when you have an infant. It's really hard to give yourself credit for feeding the baby and getting it down for a nap or the things that need to happen during that time. So how do you feel that level of self-efficacy and pride in yourself when you used to get it from working
Going to work?
So that identity shift, I think, really needs to be supported and explored and talked about, and finding ways to give yourself credit so that you can feel good at the end of the day. I help a lot of moms just write 5 things down at the end of the day that you did for your baby. Just write them down. And it could be, I got them to take a nap twice, or I was able to feed them the bottle and they were able to take it, right? If you're not breastfeeding, or I took them outside for a walk. These very small accomplishments are often just ignored and we focus on all the things that we aren't doing. So if you can shift to what am I doing? It doesn't even have to be well, just what am I doing?
Yeah.
Because often people
What
are in
did I do all
survival mode.
day?
What did I do? Exactly.
Yeah.
And just that shift in your identity, but also the shift in the lens that you take to change your expectations, and the shift to what to feel good about.
Yeah. I remember too, my mom would come to visit, and my mom didn't come to help me. My mom wasn't that grandma. She was, by the time I had Quincy, she already had all of her other grandkids pretty much.
Uh-huh.
And so she was just coming just to be with me. So it was almost like taking care of her,
Oh, yeah.
my husband, my daughter, and so more work, more for me. But yet when she left, I remember feeling, again, don't leave.
Yeah. I definitely cried when my mom left after
Yeah.
2 weeks.
I know. But it wasn't even like she was helping. It was just having that person
Having someone
there.
with you
Yeah.
all day. You mentioned, we haven't really talked about it yet, but the hormonal shifts, and I'm sure you could speak to this much more, but they're finding more and more, just as other factors leading to this that we were talking about before, is that your estrogen, I think it rises 90% in your 3rd trimester,
Yes.
your estrogen levels. And then when you deliver your baby, all of a sudden it's just back to normal. And so
Yeah, that's
our
wild.
brain actually, and so it can be patronizing to say, oh, it's just your hormones, but really it's how your hormones affect your neurotransmitters. Sometimes having anxiety, depression is not in your control. It's not external. It's actually what's happening inside of your brain. And there could be just a complete depletion of the oxytocin that you need when you need it, or the serotonin that you need when you need it, or as much as you need. The shifts in the way that your brain is regulating and your body changes, right? Everything just feels and is often so out of your control. Like, what is happening? What is happening to me? What's happening to my life? There's relationship. Once a baby's born, the satisfaction does, statistically, we know that the satisfaction in relationships can drop. And so there's so many shifts happening. And so maybe your mom not necessarily doing anything for you was just a grounding element for you.
Yeah.
I know my mom, she's predictable. I know she's going to want these things or say these things or do these things. And right. So it's some of these things that you don't know how they're supporting you, but they can just be a support just even by being there.
And how important is it? For me, it was, I think, life-saving, finding your community.
That is the number one suggestion that you would give a new birthing parent, right? Is finding people that will listen to you, that understand you, and are just there for you.
And other moms.
Other moms is
I was
so crucial.
So fortunate. I had 2, after the first 3 months, then we started to all get together, but I had 2 people that were friends, but we weren't great friends. But as soon as we all had our kids together, that was the bond, still the bond to this day, because we did all that together. But that saved my life. And I've never been that much of a social person, but it was amazing how much I needed those friendships at that time.
Absolutely. And I'm so glad that you found them. That can be hard to find those people, especially if you're introverted or you don't know where to turn to make those friendships. In town, there's the PEP program, the Parent
Right.
Education Partnership.
Yeah.
And that was started by Jane Honigman, who's one of the founders and pioneers in maternal mental health. But that's still alive and thriving. And so it's a kind of a drop-in support space for new moms. So that's sometimes if you can't find those more natural connections, you can turn to support groups, find them online. Postpartum Support International has a lot of support spaces for mothers, and they're peer-led support spaces. And there's one for military mothers, for BIPOC mothers, for mothers who've experienced infertility. So all sorts of different types of community where you can feel that sense of belonging, connection right away.
Yeah.
There's usually a group somewhere in town. There could be like, I don't know, mommy and baby yoga, for example. So finding the things that you used to love or you used to enjoy, trying to think of how can I incorporate this with my new life, with my new role, right?
Yeah.
So if it was walking, maybe finding a buddy that you can
Yeah.
walk with,
Yeah.
or I don't
That
know
helped
how you and
too.
your
And
friends found each other.
Yeah. I remember people used to tease or go, "Oh, what do you mean gymnastics? She's 6 months old." And I'm like, no, it gets you out of the house.
Exactly.
You're like with other moms and kids. That's why you're doing it. I don't want her to be a gymnast.
Yes. And it keeps you accountable, right? You might
Yes.
not have taken her out, but if you're like, okay, I'm going to meet so and she's going to be there and I'll have
outing.
someone to talk to. Yes,
Yes.
something to get done.
Yeah.
Absolutely. I'm glad that you found that, but it's crucial to answer your question. It's
Yeah.
so important and it's life-saving, like you said.
That, in my experience as a dad along the way, it was a lot of those ongoing friendships were actually started in the prenatal classes.
Oh, that's awesome.
First of all, we were getting together people at the same time in their pregnancy, and that just continued on afterwards.
It does.
With the people that you're talking about, was it because of prenatal classes that you met them in the first place? Or did you
No,
know
no,
them
it was
otherwise?
Tracy, Wiley, Anna, and Amy.
Yeah.
We all had kids within a few months.
But you knew each other before.
We knew each other before, but it wasn't like we were hanging out all the time. But then as soon as we all had our kids together, we began
and you're still hanging out.
and we're still hanging out.
It is really sweet though to see people in town or to have friendships with people and you say to your son or daughter, "Oh, you were in our bellies and we did yoga together." That's how we know each other.
Yeah.
It's a really special bond.
And your kids, they know you do have a special bond with a lifelong friend. And there's pictures of you as babies together.
Yes.
It's different.
It's really sweet.
Infertility,
Yes.
the problems that
Ooh,
creates. My son-in-law is a comedian, and he has just actually published his Netflix issue on his life tour. And that's all about infertility and going through a pregnancy. It is absolutely hilarious.
I can't wait to watch.
It just really brings people together. That his style of comedy is totally different from what he seems to be doing relative to the life tour, because he would take people through this whole story and then suddenly there's a baby at the end of it and there's applause from the crowd. It wasn't just laughter anymore. It was people crying because of the way that it was presented. But anybody that says to themselves or to their partner, okay, I'm ready to get pregnant now, we're ready to get pregnant now, the next month missing a period is too late. There's always, every period after that is a tragedy. And so it's just primed for distress.
Yes.
And you can take shortcuts through that, but they're financially demanding. To use assisted reproductive technology that's not covered by insurance or doesn't qualify in some areas. What about those particular times? Because I always felt that when I would see a patient who was having infertility issues, there was already so much stress.
And probably already so much loss.
And loss, yes, good point. What's your experience in that, Rilla? What can people do at that point?
Yeah.
Because it's not great. You don't have pre-pregnancy classes. You don't have infertility classes.
Yeah.
Or there may be some counseling that they can get for it. But what do you see as the barriers there or the difficulties there that people come across?
So many. And I think what you were just speaking to is this monthly cycle of hypervigilance and fear and worry, followed by loss and disappointment.
Yeah.
And on top of all of that, most of these people are also just going about your regular day. So you might show up for work and have gotten bad news on the phone from your doctor that things didn't work out the way you were hoping for that month. And then you are flattened. You feel completely defeated, but you have to go about your day as a regular person. The expectation isn't there set up, and you're not necessarily going to talk to your boss or the person next to you about what's happening. So it's very isolating as well. People who experience infertility are much more predisposed to experiencing postpartum mood and anxiety disorders following having a birth. I think because a lot of these unresolved issues around what happened to you during this time of trying to conceive and carry a baby to term. I think also something that goes unnoted is this, we all have this kind of birthing narrative, right? So I think everyone can close their eyes and imagine when they were a child what you thought of. Some kids were like, I'm never going to have kids. But a lot of times a child has an idea of what will it be like to have my own children. Never in their minds is it, I might not be able to, or I might have these challenges. Often the first perhaps failed pregnancy, start there. People are super resilient, but often it's this disappointment and loss around your birthing narrative that you had and processing what did you think it was going to be like, and now how is that different than reality, and making sense of that difference. It's the making sense of what's happening to you that's so important. And if you get that support along the way, if you have someone, not everyone needs counseling, but I think if you're experiencing infertility and you're going through the process, working with a doctor such as yourself, I think having counseling along the way would be really beneficial. Just a process to have someone to hold you with that anxiety that maybe you're not going to be sharing with friends or your boss, but someone who can help you process these different emotions and just give you some strategies for dealing with the ups and downs and the anxieties that come along with it. So often when I see my patients, part of what I ask is their birthing story and kind of the fertility along the way. And a lot of the work before we even get to postpartum mood and anxiety disorder issues is unpacking what they thought it would be like, what it actually was like, what happened along the way. And that is, a lot of this is, it's really great work to do. It's fun, it's accessible, but we get in our own ways of taking the step to actually seek that support because you're like, I don't have the time, I'm working. Or a lot of people are like, I just didn't really know that it was that bad. Or I just didn't really know that it would affect me in this way. I just thought it was normal to be sad, or I just thought it was normal to feel this way because we were experiencing infertility. Well, that might be true. It doesn't have to be normal to stay in those feelings because really counseling and therapy can be so healing during this time. Even amidst ambivalence, that, just to mention ambivalence, is so hard for most people to sit with. But to not know if you're ever going to have a child or what that will look like, that is so destabilizing. How do you get your grounding? How do you feel like your root? How do you get in touch with the things that keep you feeling strong and happy and connected to others when it can feel like nobody else knows what this is like?
It's very alienating.
It is, and it's not
like a lot of things, like illnesses or other things people go through.
It's so intimate and personal, the sense that you wouldn't want to check in with someone, how are you doing, and just share with them. But for people, it's the only thing that they're thinking about for a very long time. Being alone in your own thoughts, and how you're experiencing it maybe with your partner can be different as well. So that might be further exacerbating some of these anxieties and sadnesses, the lack of support, and often just not even knowing that you need it. I think that's what I find so prevalent is I just didn't know that it rose to the level of needing support. I'm here to say that it doesn't need to rise to any level. You shouldn't have to suffer. You shouldn't have to feel that way alone. There's so many resources to get support and just to have someone to listen to you.
And do you counsel couples?
So I don't love couples counseling, but I will see couples if I think it would be helpful for the progress of the person coming to me. If there's been a loss that needs to be resolved together with, for example, a birth trauma. If the mother that I'm seeing is, I don't know what was happening. I don't know when they took the baby away. If there's a lot of unanswered questions, it can be helpful to say, let's bring your partner in and see what, from their perspective, what was happening, because that could be grounding. Yeah, they had to take the baby because of XYZ. You were in this state. So sometimes it can be helpful just to have that additional information and support, to have the person with you. But I don't particularly love doing couples work. And I never have. I think I'm such a problem solver. That's not always helpful, honestly, couples counseling. And when I have a couple in front of me where there's a lot of conflict, I just find I run to this problem solving, and it's not the way I like to show up as a support person.
Yeah, that makes sense.
Maybe one day that will change. But yeah, so I will bring in couples as the support process and flush through things, but not as a container for the relationship.
Many years ago, when I was doing OB, some students from UCSB asked if they could come in and, with patients' permission, come in and just observe what it was like to be in a room, or what it was like for the parents, for the couple. Because this is when husband coached, partner coach childbirth was ripe. I think fortunately that's disappeared to some extent.
Yeah.
Because husbands were horrible coaches.
Oh, my husband was right in there, really trying to coach me along pretty quickly. And I was just like, okay.
He's all right.
When I need you.
After him.
When I need you.
Anyway, I remember once when I was looking after a patient in labor, and there was one of these people from students in the room as well. And progress was slow in this pregnancy. And I said to the patient with the husband there, I said, don't worry about this. We've got lots of time. I've got nothing else to do today but look after you. The student went back and talked to the parents and said, how did you feel when Dr. Tennant said that to you? The patient said, I was really worried because I thought, I don't want to inconvenience you so much.
Yeah.
And the father thought, God, I'm glad he's here.
Oh, yeah.
So interpreting what was said at the same time to those people was received totally differently.
Absolutely.
Between one and the other. So maybe asking the dad how it went that way wouldn't have been any more accurate than what the mother was remembering in the case that you mentioned, if there'd been some trauma. But it's amazing how the same sentence can be interpreted in a totally different way.
Absolutely. And I think especially when you're outside of your comfort zone, we don't really know what we're doing when we're walking into an operating room. We defer to the doctors as the experts. And you hear things where you're like, that sounds really scary, but to the doctor and the nurses, it's something that they see 1,000 times a day.
We shouldn't really say oops.
And it's just a scary time. You just want your baby to be delivered and healthy, and for yourself. And I think that the statistics right now are like 1 in 5 people experience their birth as traumatic. And so really being able to understand, what does that mean to them?
Yeah.
What was traumatic about it? What was scary? Where did you think that your health or the health of your baby was in jeopardy? Just understanding that and talking about it so that you can get the partner's information. No, you really weren't. They wanted to get things done quickly, but nothing was really in danger at that moment in time. That can be helpful to hear.
How long have you been in Santa Barbara?
I came in 2008 for graduate school.
And how are you, or what are you feeling about this community and the OBGYNs? And are you working with some of them? I met you when you were with Dr. Drake.
Yes, I'm encouraged. Sorry, was there more to your question?
Well, I'm just wondering how that's gone, because Santa Barbara is funny. It's a funny place, a rather closed community. So it's hard for new people coming in, as it was for Dr. Drake.
Yes.
Years ago. I'm just wondering how that's going for you.
Yeah, I'm really encouraged right now because, one, there's so much more information and research being done in this area of perinatal postpartum time. So I think people are investing more, whether or not it's through funding, but just paying attention.
Yeah.
And I think that, so when I opened my private practice, there were 2 other people in town that were doing this type of work. Now, if you go into Postpartum Support International, they have a directory of providers that have been trained under PSI, and there's 20 of us in town. So I'm encouraged. And last year we had a consultation group of all the therapists who provide this kind of support. And there were, like I said, about 20 of us who came together and talked about our work, and everyone was really friendly and inviting and open and sharing kind of the challenges and the highlights of our work. And so that community was really open. But when I opened my private practice, to speak to your question, I was offered a free workshop in PMEDs and had posted, and someone in the birthing community was like, who is this woman? And why is she calling herself a specialist? And I had for 25 years been working in the field of 0 to 5. So I think because in Santa Barbara, and I think in working in this field, people feel really protective of mothers and they feel really protective of this community. But what I see happening is that people are becoming more open and wanting to collaborate and for the purpose of supporting mothers and children.
Yeah, it's definitely shifting right now, I feel too. So there's a lot of new people coming in, people that have been here for a really long time exiting. So I think your timing is really good.
I spoke to one person who offers this type of support, and she's been around 20 plus years doing this work and just is now getting licensed as a provider. And she said something to the effect of, we feel in this community, we feel really protective because there's often people who get excited about this around the time that they're having children, right? And so then they get excited in the field, but then they leave. And so I think that there's maybe some, how invested are you in this and in our community? People just want to vet. And I noticed that in Santa Barbara, there's a lot of vetting of who are you and what do you have to offer?
Gaining trust.
Yeah.
You have to gain
establishing the trust.
And
So
also
important.
just the tendencies right now with people just hanging up a plaque and saying, this is what I am.
If you're looking for support, do your homework and see what the credentials are of the person that you'll be working with and talk to them and see if it feels like the right fit, because that's really important too. People that are in this field are just open, warm, and loving people by nature. Who else wants to be around like mamas and babies? So I think that once you get plugged into your community, and then a lot of it is just word of mouth, right? Once your community, you're like, okay, this doctor knows this doula well, or this doula knows this pelvic floor therapist well. So just talking to people and people that you trust to get those referrals can be really helpful too. In terms of like therapists, there's Psychology Today that you can go to, and different therapists have their profiles up and what they specialize in. So you can look to see if anyone puts perinatal or postpartum time. Also, there's Postpartum Support International that I keep plugging because they're wonderful. And they have a directory of people that have been trained specifically in this type of work.
What's the lifespan postpartum?
80% of those people go untreated for some of the things that we spoke about. There's like shame, guilt, maybe barriers to access to care, not knowing you need the support. And what we know about that kind of the life cycle of that, those symptoms can be up to 3 years postpartum. Wow. And what we know, unfortunately, is that untreated postpartum depression and anxiety actually can have really negative effects on the children and the baby as well in their development. So it's really critical to get in early, like those early windows, especially during pregnancy. So like the number one predictor that you'll have depression or anxiety postpartum is if you had it during your pregnancy. So just asking those questions of yourself and of your partners or of your patients. Are you experiencing feeling down? Have you been overwhelmed? Any anxiousness or fears around anything in life right now?
Yeah, I didn't have anything during pregnancy. I just felt fantastic. Nothing bad.
Yeah. And so you're not expecting the
And it
roller
wasn't
coaster.
bad. It didn't last. Like I said, once I found my rhythm, like in that, I'd say 3 months was the marker. Everything snapped back.
Frequently ask those questions of patients, or is it the OB visit can be very brief?
Yeah. I think that you have questions that you need to assess whether or not the mother and the baby are healthy. And then I think that while those questions might be there, it might be like a blanketed, and how are you feeling?
Yeah.
Rather than more specific. I also don't think there's a ton of training in obstetrics and how to support, because you don't have the time. It's not necessarily billable under your credentialing and your services. The time to say, if a mother comes in, right, and says, I've been weepy or I've been having a lot of fatigue. Often it's like, yeah, you're tired. That makes sense. But there's not a lot of time to go into the details. Well, tell me more about what the fatigue looks like. So while I think OBs are aware and in tune and possibly trained, I think there's a limitation in the time that they have with the patient. And what my sister-in-law says is, I want to support them, but I don't have the time, but I also don't have the training and what to say or do and how to support them. But that would be a really good time to just make a referral or just drop a line like, oh my gosh, you're tired. Okay, that can be normal. But also if it extends, if it prolongs, if that fatigue gets in the way of you being able to like meet your baby's needs, come see this provider. There's all sorts of providers out there that can provide some counseling support around there. So I do think the awareness is there, and I think the intention is there. I just think there's limitations to the medical model.
There was a time in my practice of OB, which it was maybe a 10-year time period where I had a midwife.
Yeah.
These were only but hospital deliveries. And she would see the patients every time they came. She'd see them the first visit. She'd see them all the way through the pregnancy. I'd see them maybe twice in the pregnancy. I'd meet them way back when, and then at about 36 weeks, I would meet them again. And when they went into labor, they called Judy. She'd go into the hospital. She'd let me know that there was a patient in labor, but the plan was not for me to be there at all. And usually that was the case. But I would be just more available when she had a patient in labor. I look back at that as being the best I ever practiced obstetrics. The only thing I was needed for was repair work of the anatomy, or doing a C-section, or maybe doing an operative delivery. But it wasn't, Judy could do things better than me for a lot of it. She had more time. She had 8 or 10 patients a month, and she had lots of time to deal with it. And it was just very positive. And I get a lot of feedback from patients today, even, that I'll remember when you and Judy looked after my pregnancy. It was a great privilege to be involved at that time, but it was something that Judy and I did really well. And then when she decided to retire, I never found a midwife who was that good.
Wow. Yeah, midwives are incredible. And a lot of OBs tell me that when they get to collaborate with a midwife, whether or not in their hospital or in their practice, that they find that to be much more satisfying and enjoyable, their work as an OB, to have that partner and consultation collaboration with a midwife.
The midwife was there as a doula, not doing the delivery. It wasn't given part of the care, but was very protective of the patient and questioning everything that went on. And it wasn't good. And I had trouble getting my midwife privileges at the hospital. It's one of those things that was really unpopular with my colleagues.
I think things are changing now. I think that they're starting to see more value in having a midwife.
It makes
in the hospital.
so much sense.
Yeah, it makes a lot of sense. There is the Edinburgh Postnatal Depression Scale that usually is administered by OBs following the delivery of the baby. You can give that during pregnancy. So they're being administered and people are filling them out, but I don't know. If you're a patient at that time, I would ask, what's my score and what does that mean?
Okay.
So the doctor can reflect back to you, oh, okay, you're an 8, so you don't meet threshold necessarily for postpartum depression, but it looks like on these items.
And when is that done?
It can be done the whole year after a baby is delivered and during pregnancy.
Yeah.
But typically, I think it's given, at least locally, I think it's given at your 6-week follow-up.
Okay. Good move.
I'm not sure. I'm really tired. And they'll give you the skill when you go for your visit. And they didn't back then. So I'm happy to hear now that they are at least administering it to everyone.
Yeah. I didn't know that either.
Yeah, I feel like the whole postpartum, I think of this too a lot with the surgical cases that come through our office with Turner, and then we have a plastic surgeon in the office as well, that the patient is left to recover. They're in their post-op time. And sometimes there's not enough support in place for those times because patients don't really know how to stop and take care of themselves and do what's needed to really recover properly. And I feel like with having babies, it's the same way. You deliver that baby, you're on to the next thing. You know what I mean? My job is done, check. And then you take the baby home, and what is there for you to really get through the next few months? Yeah. So sometimes these things they're not looked at or built out, let's just say, in our society as much as they should be. Because it's a key component in the success of a surgery or how things go after you have a baby.
Yeah, so important. You think about any surgery, any elective surgery, or going to get your hip replaced, and you have instructions, and people send you with instructions. They follow up with you maybe once a week, every day. They wouldn't expect you to get up and take care of another human right after, but it does happen for birthing parents. The 9 months leading up to you're seeing a practitioner maybe every month, maybe every week. And then all of a sudden you're on your own for 6 weeks. How do you take care of yourself? Just knowing how important that is and that you need to take care of yourself in order to take care of your baby. I think just that alone needs to really be emphasized, because the shift and the focus now is all on the baby. But if you're not, likely the baby's not as well as they could be. If you were able to wash your face or maybe take a shower outside, or just even the physical care that needs to happen.
Yeah, that leads me to my next point, and this new trend right now with new moms is getting a baby nurse, which when my group was having kids, nobody would have thought to do that because at that time, women had to be doing it all to be doing it correctly. So it was more like a badge of honor that you didn't have help.
Yeah.
Well, I don't have help. You wanted to be able to say that. But now women are like, oh no, I'm getting a baby nurse and I'm going to have help. Good for them.
Great.
Like, that's great.
Yeah.
What are your thoughts on that, the baby nurses?
Yeah, I think that if that's available to you, then, and it helps you recover, if it helps you be a better parent, if it helps you be a better version of yourself, it helps you stay healthy, absolutely do it. I think, but it is definitely, it's a privilege that not a lot of people can have. But I think if you can, yeah, go for it.
It is a privilege, but is it, like we were just saying, should insurance cover all these things that would better support the mom being a great mom and easing into the change?
Yes, my answer is yes. Yes,
Yeah.
it should be. A lot
Right?
of these things that should be there that are not in place. Right now, it's seen as a luxury. But yeah, I think we used to have Welcome Every Baby in town, where a nurse would go and check in on parents a couple weeks after delivery just to offer some lactation support and kind of some health support. So there was that. I think they're working on now getting that back up and running version of that, where you're having nurses visit at you at home once you have the baby, like night nurses, night nannies. I think
The night nurse, the schedule, they put the babies on the schedule and
absolutely.
get them on the schedule. They're there for the first 6 weeks and then they
Yes.
move on to the next little baby. And then,
If you
Yeah.
can do it, and should it be more accessible? Absolutely.
Yeah.
Yeah. And back in the day, you would have an auntie doing it, or your mother, or someone to step
Right.
in and help in those moments, because waking up frequently throughout the night is just a recipe for
right.
for you
And
to
then
feel
having to get through the day.
tired and sad and anxious
Yeah.
through the next day with your baby. Yeah.
But now you're doing the counseling and therapy. But you have another job with Calm.
I do, yes. I was in this for the last 9 years. I've been at UCSB as a therapist. I needed a bit of a break once I was having my own infertility and I was working with mothers and babies and children. I needed a little bit of break from that and from trauma. So I went to UCSB, but at the same time I had my private practice. So that's how I got my fix of working with mothers, was through my private practice. Last year I helped a local nonprofit get up and running for a maternal mental health clinic. And I loved the programming. I loved the directing. I loved supervising. And I loved it so much, but there wasn't enough legs for this organization to really take off. And so I knew that I needed that. My brain really wanted to do programming and development and management, but I just stayed open. I said, okay, this nonprofit didn't take off. I'll stay open. Maybe I'll lean into opening up my private practice full time and just do that way. But I was contacted by a friend and said, you should really look at this position. CALM is a local organization that works to prevent and treat trauma for children and families. And I did some of my postdoc hours there 12 years ago. And so I looked at this job description, and if I could have written the perfect job for myself, it was there on paper, written for me. And I really get to lean into my specialization around 0 to 5, supporting children and families, but from a management perspective. So I get to support the clinicians who are going into the homes and working in the clinic with children and families during this really sensitive time.
Great.
So I'm 1 month into my new role and I'm loving it. Feels really good to be back. It's meant that my private practice is smaller. I'm staying with the clients that I had before. And it's one of those things that will be a lifelong, I'll always be able to do private practice. And so when the time is right, I'll let you know when that's back up thriving.
That's great.
Yeah.
Thank you.
You're welcome. I realized I haven't really gone through the 101 on what postpartum depression and anxiety can look like. I can do that.
Yeah.
Yeah?
Absolutely. Yeah.
All right. Postpartum depression can really, you spoke to some of the isolation, the overwhelm and some of the hopelessness. So sometimes people can feel like, oh, I'm never going to feel rested again. I'm never going to feel happy again. What did I do? Things that you don't talk about. I wish I had my old life back. So some of those thoughts and feelings of, oh, this doesn't feel as good as I wanted it to feel, or a lot of guilt around, oh man, I'm just too tired to play with my baby the way that I want to be, totally engaging with them all the time. So it's not necessarily, I don't have interest in my baby. That is a very clear sign of postpartum depression, but it might be a little bit more nuanced. I really don't want to get up and feed her again. And it might just be exhaustion, but it's not that you don't love your baby and want to connect. It's just that there's something getting in the way. There can be a feeling of dread, right? To want to get up and get through the day, that feeling of dread. Any significant changes in appetite or sleep patterns. And of course, that's hard to say when you have an infant at home, right? Because your sleep will be disrupted. But if you can't, having a hard time falling asleep or staying asleep, that can be a sign of depression. Significant changes in your personality. Again, you're going through an identity shift. But the things to look for are what filled you up before you had a baby? What made you happy? Are those things no longer appealing to you? Right? So changes in the way that you're relating to people, changes in, I just don't feel like myself, or I feel outside of myself. Thoughts of harming yourself or harming your baby are signs of depression. And also if there's thoughts of harming your baby, that can also be like an OCD, a postpartum OCD or anxiety. Often we have these intrusive thoughts of the worst case scenario of what can happen to your baby. Everyone has them, but there's a mechanism in your brain to say, that's not likely, you're fine. The people who can't soothe themselves and say, you're going to be fine, and then that thought and that image appears, that's a time to get help. Changes in sleep, changes in pattern, changes in feeling who you are. But is it getting in the way of being the person that you want to be, connecting with the people you want to connect with, or achieving and functioning the daily tasks that you need to do? Is it getting in the way of you getting outside for a walk? That can be really overwhelming to someone with postpartum depression. Just getting out the door can feel insurmountable. So if you feel like I can't live the life that I want to live right now, that might be an indication of depression. With anxiety, some of these are overlapping, right? So not being able to sleep when the baby is sleeping, changes in your patterns and eating as well. The sense of overwhelm, like everything feels really daunting. And this hypervigilance, so your hypothalamus, which is always scanning for danger, is on, right? So for some people, they're unable to quiet that. So they're always feeling on edge. Their baby is crying and everything in their body just feels overwhelmed. They're startled. Everything feels like it's too hard to do. Like bathing your baby isn't enjoyable because you're holding onto the slimy baby and hoping that they don't fall into the water. That's a sign that maybe some anxiety, just the constant worry. It's normal to worry, but it's constantly worrying. And that worry is getting in the way of you engaging with your baby or with other people in your life or doing the things that you need to do. Constant checking, right? So thinking more of OCD, there's these oxygen things that people can put on their baby's toes to make sure that they're breathing well. There's all these monitors, right? It's helpful, but then sometimes it can really get in the way of you just being with your baby, right? So if you're just constantly checking your baby's breath or their oxygen, checking them over and over again in the way that it's getting in the way of you living.
They have these cameras now
The
over the crib. I think if I had that, I would never get anything done.
And for a lot of my clients that I work with, sometimes it's just coaching around. It's okay to turn the baby, like figuring out if the baby's gaining weight, they're on a regular routine or whatever's happening, like turn that monitor off because you need to sleep. And that's important, learning how to press yourself. So yeah, just the overwhelming sense of this feels way too hard and I'm on edge. A lot of times there's good reason for it, especially with like infertility or some kind of a traumatic event during birth and delivery, is your body just needs to learn that there's no danger. That hyperarousal you just need, and there's, again, this is very easy to work with in therapy if you have the right tools and the right people, just learning how to ground yourself and teach your brain again that everyone's safe, right? So those are some of kind of the telltale signs. A lot of times I'll see my clients when their child is 2 years old, they'll come to me as a new parent and they're like, I didn't realize how overwhelmed I was at that time until now that I'm sitting back and reflecting. So a lot of time postpartum anxiety isn't really identified until years later. And so that can be when there's time and moment for reflection. That's when you see, wow, that was way harder than it needed to be. Yes, I got through it, A lot of times people grieve that they weren't able to be present enough because of their own worries or anxiety or the brain fog and the fatigue that comes with depression. So that's also a really good time to get into counseling, is if you're thinking about having a second and not sure, just to process, is this the right decision for me and my family or not? And how do I prepare for the next one? Because there are all sorts of things that you can do. For example, you can be on an SSRI during pregnancy and postpartum. It's just a matter of knowing, your doctor knowing, and you knowing if that's the right decision for you and your family.
Yeah.
So those are some kind of 101 around postpartum mood and anxiety disorders.
Yeah.
And again, not your fault. You're not alone. And with support, you can get better pretty easily. Some of my clients, I see 2 or 4 sessions and they're like, I'm feeling a lot better. I just needed to have these certain strategies and I'm ready to move on. And then some people I see when their children are 7 and they just like having the additional support.
Is there a lot of reluctance from patients?
Yeah. Yes. I think a lot of people don't know how to or feel comfortable asking for help or support or saying. I think COVID has changed that somewhat. I think most people experience some type of depression or anxiety during COVID. I think the statistics are showing us that. And so you see the uptick in like BetterHelp and all the kind of online telehealth that's available. So I think most people now realize like there's nothing wrong with getting help, but it's just a matter of saying, my sister needs help. Yeah, I'll get her into therapy, but it's, do I need it? Feeling like you need to admit to yourself, I need support, rather than I should get some support. That would be helpful. It's changing the dialogue.
Yeah. Okay.
So there is a lot of reluctance, especially for the very high achieving women that I see in my practice.
They should be able to handle this.
They have weathered all sorts of different types of storms and overcome all sorts of different challenges. I think, and a lot of the skills that we develop to be resilient and cope sometimes are no longer available to us when we have a baby. So some of the things like, okay, some people work out for an hour every morning and that really helps with their mental health. Sometimes that's not available when you have a newborn or a baby. So it's just fine tuning some of the things that used to work for you or realizing how some of the things that used to work for you are no longer healthy for you.
Yeah.
Exactly.
Thanks.
Yeah, you're welcome. I think it's just to reiterate that therapists are usually pretty warm, empathic people and are there to help and support, and they're very non-scary, and it might take time to find the right person. So call and do consultations, find someone you feel comfortable with, and just start the process. That's the hardest part, is starting. Once you're in, it's easy, so helpful.
Good advice.
And do you do telemedicine?
I do.
Okay.
I think it's also really helpful for moms. If you have a provider, if you're working with someone, you have a new baby, you should find a provider that would be comfortable with you bringing your baby in. But sometimes it's just really hard to get out the door and get anywhere on time. You cannot predict if a baby's going to have an accident or burp up on the way and you have to turn around. So I think telehealth is really helpful for new moms especially.
Thank you.
Yeah. It's been a pleasure meeting you both and sitting down with you.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.